Hey guys, Dr. Brennan and Dr. Kylie here from Auckland Health and Performance. Today we're going to be talking about shoulders. So what are some of the main causes of injury and some top tips around it as well. So what are some of the main things that you see with shoulders?
So the shoulder joint is quite a complex joint. It needs to slide and glide. That's the most important concept that we learn as sports chiropractors is things need to move well. So we've got our arm bone that connects into the socket, and that needs to rotate properly and not get stuck in there. And then our shoulder blade also needs to slide over our rib cage to move our arm above our head. So there's a bony alignment issue sometimes, and the neck can heavily be influenced there. It can heavily influence shoulder mechanics, as can the rib cage and how that's moving the shoulder as well. And then you've got that muscle component on top of that with the rotator cuff, and its job, as we know, is to stabilize that position. And the fancy word for that is centrate or get that bone moving in proper alignment in that shoulder joint. So then we can get our arm overhead without that excessive clicking that sometimes patients will report, and that pain sometimes that my heavy weightlifters will often misconceive as bicep pain, which is coming from a really tight rotator cuff or infraspinatus at the back of the rotator cuff. So what do you think the common causes, or what do you see people coming in to you with?
Yeah, a lot of times just those heavy workers as well. So people lifting, painters, people that are just constantly using their shoulders and arms just for their general work as well. And yeah, it's kind of that differentiation again between muscular or joint issue, which again, a lot of times they're quite combined. So if the joint's not quite centrated, having that stabilization, and if the musculature isn't allowing that movement as well, you're just setting yourself up for injury. So what about yourself? Oh, you said lifters.
Yeah, so what we see with shoulders is making sure, what we see as chiropractors and how we like to look and approach shoulder injuries is making sure your neck's moving well, you're breathing really well, you've got your shoulders and rib cage moving well. And oftentimes I'll see patients that are trying to overhead squat and they start getting shoulder issues, and that can actually be from poor ankle mobility as well, affecting that entire kinetic chain. So we will, when we're looking at patients, look at that whole system to make sure that that the ankles and hips are moving well, not to create that shoulder problem upstream when the actual cause and root cause of the problem can be poor ankle mobility. So that's just something else to consider as we're assessing our patients.
Making sure it's all a well-oiled machine. So what are some of the main symptoms you see?
Symptoms is just excessive clicking, pain radiating to the front of the shoulder, pain down to the top of the deltoid. Oftentimes concomitant with is neck pain. And what else? What else do we see with shoulder pain?
Yep, a lot of times, yeah, going up as well into the neck, mid-back pain as well, so between the shoulder blades. So, and then, yeah, that whole thoracic rib cage, blocking that out as well too. So
awesome. I think we covered it all.
Yeah.
Thanks, guys.
And then stay tuned. We're going to be talking about some top tips for shoulders as well. So.